Hi, my name is Rachel Nelson, and happy Black History Month. Listen, breastfeeding is extremely important as it is one of the best things that we could ever give to our babies. It's also important in the Black community because we have one of the lowest breastfeeding rates and racial disparities still exist. This is why it is imperative that we have easily accessible support groups and lactation professionals that can help lead and guide the lactating parent on their journey with evidence-based advice and guidance. It is my belief that if we can do that, then we can increase those low rates. I hope that each and every one of us in this community will do our part and play our roles in increasing those rates. And remember, Black history and awareness doesn't just stop in February. It exists all year long.
Breastfeeding is really important in the Black community because unfortunately Black women have the highest rate of having babies born preterm. And unfortunately we have a really pretty high rate of our babies dying. And research has shown, according to the CDC, that breast milk has all the nutrients and the antibodies that our babies need to thrive and flourish. And unfortunately, Black women have the lowest breastfeeding initiation and breastfeeding rate. And I have taken it upon myself, a personal commitment to help as many Black women as I can, because I'm a strong advocate for breastfeeding. My son will be 3 this June of 2021, and I'm still nursing my son. It's just important. I believe that's why he is as smart as he is, why he retains information the way he does, why he can just say things. I'm like, I said this to you 2 weeks ago, and he could just retain information. And just breast milk is just amazing. And let's not get to talk about the importance of what it does for the woman. Anytime and every time that I breastfeed, my chances of breast cancer, heart disease, and cervical cancer go down each time that I'm breastfeeding and the longer that I go. So it's just really important. And I wish more women did it, especially Black women, since we have the lowest rates. And I'm going to do everything I can to help change that. And I hope and pray that people continue to breastfeed or continue to educate their peers, because we really need it. We really can change a generation if we provide them with the nutrition that comes from our bodies naturally. Sure. Okay. Hi, everyone. Again, thank you all for allowing me to be here. I am Jillian Gray. I'm the Chief News Reporter for Better Black News, and I'm a huge advocate for breastfeeding. I am still breastfeeding my almost 3-year-old son, and I'm happy to be on this panel.
Wonderful. Who wants to go next? Maggie.
Hello, I can be heard, right?
Yes, ma'am.
Okay. Hello, my name is Maggie Green. I'm a licensed clinical social worker. I've spent the past 10 years in medical and public health social work. I've had some experience in maternal and child health and dealing with infant mortality and maternal mortality and medical case management.
Hello, my name is Dr. Noor Jihan Abdul-Haq. I'm a board certified pediatrician. I'm the owner of Peace of Mind Pediatrics in Del City, and we'll soon have another location in Northwest Oklahoma City. I also am the medical director for the Clara Community Health Center, which is a free clinic for the uninsured. I'm a mother of 3 children, twins, and also a 6-year-old who I've had the pleasure of breastfeeding them all. And I am grateful for being here today.
Thank you so much for being here. I fear that we have lost JP once again. And so I'm wondering, Amanda or Becky, before I just take over, if one of you have the questions in front of you, would one of you like to read off our first question? And if not, then I'll go ahead.
So the conditions in which we live explain in part why some Americans are healthier than others. Analyses show that social determinants such as gender, occupation, income, and race, ethnicity can radically influence health outcomes to create hierarchies of health and illness. So what does that look like today in Oklahoma's urban and rural communities? And maybe what are two to three things we can work towards to increase breastfeeding numbers for our African-American families in Oklahoma? So what does that look like in today's communities in Oklahoma, and then what can we do? So whoever wants to, looks like
I
Maggie's
can,
trying
I
to.
can start.
Okay.
Oh, sorry. Yeah, I can start. So in terms of what health equity looks like, a lot of people talk about health equality, but equity is different. It's actually seeing that there's the disparity and actually giving people the tools to actually obtain and receive the best benefit. So some of the things that I think would be most important is really educating women before they actually even give birth. I find that so many women are asked the question, do you want to breastfeed? And they're like, I don't even know. They don't really even understand the anatomy of the breast. They don't understand where the milk comes from. They don't understand that the first few days in the hospital, you're going to have colostrum. You're not going to have a surplus of milk, and that the baby is still being fed. So I really, I applaud, there's several organizations trying to do this, educate women who are pregnant about it. But the question is, are our programs within their communities? So a lot of times we create programs and we have several of them, but they're not within the communities where the women are. And so it's like, how do we meet people where they live? And of course, now we're doing Zooms and things like that. But even some people don't have great connections, right, for Zoom, so they can't even participate. So how are we meeting people in the best places? And I know that a lot of people will say, oh, well, maybe we'll go to churches or religious facilities. Whereas that does help a lot of young people. I don't even see them, going to these places anymore. I'll be honest with you. And so we have to become a little bit more creative. And maybe we have food. Maybe it's a pamper you party. But at this pamper you party, we're also giving you information, education, etc. So definitely making sure that we pay attention. And you can obviously start with the zip codes, because as we know, your zip code often is a predeterminate for your health outcomes. So I think that would be a great way of trying to, seeing which areas that you should definitely target and see how we can best put programs within those spaces.
Okay, yeah, that was a loaded question. That was a lot of questions in there. I want to first talk about health equity in relation to receiving appropriate equal care. And that's literally what it is. Everybody has to have availability to receive equal care, accessibility to receive equal care. I think in relation to speaking on African American women, we are already disadvantaged before we walk through the door to receive our pregnancy test. And what that looks like is when you have institutionalized racism, you systemically have systems in place that are in favor of whites and not of blacks or other minorities. So when you have those type of things, it can definitely cause inequities in moving forward. And secondly, I do want to point out, me being a social worker, so I work hand in hand with behaviors and things in association to making sure that mom are successful in women's health, pregnancy, delivery, and postpartum time, is that for more equity and to be better as healthcare professionals, we definitely want to stop blaming the victim. Okay, we want to stop blaming the victim and her inability to be successful in breastfeeding. Because just like I had identified before, systems are not meant for me to be successful as an African American woman. So what can we do best to make sure that we understand that, okay, based on these circumstances and based on this individual being socioeconomically marginalized, maybe I need to look at the whole system in regarding to this mother and how I could best assist. Maybe she's not understanding the education appropriately. Maybe she doesn't have time. A lot of women of color, African American women, have to return back to work in a short amount of time frame, so that it can be discouraging in being successful with breastfeeding. A lot of the places that they're employed at do not have breastfeeding accessibility available. So, and also too, in regarding to women's health, bouncing off Dr. Nora and what she said, we have to be able to have accessibility with doctors in place, lactation consultants that support us. We also have to have access to fresh foods and things like that, so we can be successful as women who are in childbearing age and to be successful. But this is a topic that definitely, has a lot of things to break down in order to be successful. Yes, we need funding to best assist African American women of color, but in reality, we need person, systemic change with individuals, and we can definitely change our numbers when we look in the mirror and self-assess in relation to why we haven't seen successes in numbers in African American women in breastfeeding.
And to piggyback on what both of them said, I really feel like that leads to more peer-to-peer help with each other, because I feel like if one mom knows something, she'll be able to help another mom. And so if we can change from the top, it'll all trickle down. And I know for me, that's my biggest thing. Like when I'm helping moms, I always tell them, like, I'm not a lactation consultant. I'm just a mom that's done it and is still doing it. And that's what I go off of. And you want to be able to relate to people. So I think, once we start to the top and it just trickles down, it'll fix itself.
Wonderful. Thank you so much.
But I will ask this question. One fact is that the rates of breastfeeding in the African American community are significantly lower than other ethnicities. This situation results from a combination of socioeconomic, cultural, and healthcare system issues that reflect persistent structural racism and the generational trauma legacy of slavery. Acknowledging that the horrific experiences of the past impact on societal attitudes, behavior, and practices of the present is a critical first step in addressing this continuing public health tragedy. What do you suggest as the next step?
So kind of that generational trauma, how do we?
And I was going to say there was a little thing to that. If for people who don't, the generational trauma legacy of slavery, in addition to that question that Amanda didn't have, creates a lingering ambivalence to breastfeeding among Black and African American women. And a lot of people don't know about that generational trauma. So as the question said, acknowledging that trauma and how it's still here in the present is a critical first step. But what's the next big step to help us, get that out and help people to understand why this is an issue?
I don't always want to go first. Maggie, you go first.
I'm trying to click on. It wasn't clicking.
Okay.
It wasn't clicking right. I do want you to speak on the medical component of it, though, Dr. Nord. But I think I think of today in going through COVID-19 and how we see significant amount of numbers in the African American community. And when we think about generational trauma that occurred, it has to do with trust that is present today. It's interesting, you actually literally think in layman's terms, well, how are whites more successful in breastfeeding than Blacks? It's about the approach. It literally is about the approach. The warm rapport you build with someone, that's humanistic. If you go in and before you go into the door, healthcare professional, lactation consultant, social worker as I, and everyone begins at the same baseline and starting point. When you go in and be humanistic and you want to build rapport with people, you can empower individuals and things will change. Mm-hmm. But based off of implicit bias and things associated to our history, we already have pretty much a butted head with how the Black mom thinks and how healthcare providers think going in. Is just facts. And that's why I spoke of earlier in regarding to blaming the victim. Well, she just won't get it done because she's not compliant. Hold on. Let's understand the circumstances on behalf of social determinants of health. We're already, before we even walk through the hospital doors, I already have a million things in front of me before I go in. I know I'm 3 times more likely not to make it out of delivery or within a year of postpartum. I know that my infant more than likely, 3 times more likely, may not make it due to that. So I already have all of these barriers before I enter the door. So in relation to that, I think to really break down generational trauma and our mistrust with the system, we already believe you don't believe in us when you come through the door to help me. Mm-hmm. So when we have that and we realize that, and we start being humanistics and humans, it is nothing wrong with saying, I think you will do great at this. I think you can do this. It is a powerful thing in empowering individuals and learning motivational interviewing. And maybe that needs to be something that you all look into, is motivational interviewing and empowering individuals. Things will change without funding associated to that. When we just go back to the humanistic things in the beginning of building rapport, you will be surprised how numbers increase and we see better numbers for African American mothers breastfeeding.
It's indefinitely, I mean, you hit on, right, the nail on the head in terms of the humanistic aspect. And humanism is lacking in medicine. And it just has been. I mean, I'm actually a scholar for a program of humanism in medicine. We actually had to create a program. So that's how you know we're definitely lacking. I think that when we talk about the trauma, a lot of times we will, we talk about the historical aspect, the generational thing. I will say that over a period of time, there actually was a time where we were breastfeeding a lot more. And that was, you started to see that. But then when formula came out, it was almost like a status thing. Like, oh, well, you guys breastfeed, but I can afford this formula. So it became the new hip thing to do. So you'll find a lot of mothers, especially people, their children probably be around my age. A lot of them, their parents were like, formula is good for you because it was marketed as being just as good and you could go back to work and you could do all these things. So you have to understand how that, played a role in women, especially women who may not have had a lot of affluence or a lot of status, to think that this one little thing made them seem as if they had a little bit more. And so a lot of those mothers are the grandmothers or the, of a lot of these children. So they're telling, well, I gave you formula and you turned out fine. There's nothing wrong with you, is there? And so it's like, okay, well, how do I counter that when someone says, I grew up on formula and I'm perfectly fine? And so being able to, one, not take offense to that statement, but being able to step back and say, that is true. You look like a healthy individual and you turned out fine. And that's not what we're trying to say. We're not trying to say children who drink formula or do not turn out okay. What we're trying to say is that breast milk has these benefits. And these are the benefits for the mother. And not just giving them a sheet of paper that says these are the benefits. Because people are like, I don't even think I'm at risk for this anyhow. And so kind of helping people overcome that. Also, just the concept and idea, a lot of women have issues with their bodies. And it's something that needed to have been dealt with and fixed before they were ever pregnant, as Maggie was discussing. But, now you may have them in your room. So being able to ask, do you have any concerns with, the baby latching to you? Do you mind if I look at you? So many times people come in the room, because I see babies after birth, right? So I'll see LCs come in the room and they're like, oh, let me help you. Let me see how the baby, and I'm like, first you need to ask them if you can see them. And you definitely need to ask them before you touch them. Mm-hmm. Because for some people, that touch, that was enough. I don't want her back in here and I don't want her touching me. Mm-hmm. And I don't want the baby touching me. Because they may have a trauma or they may have something else that has happened in their lives. And so I know people are trained in these things, but a lot of times we forget them because we get so comfortable and there's so many people who don't care. But you may have that individual. And I come from a pretty modest background. And so I'm kind of one of those people who don't touch me. Like, you need to, like, I don't need you to touch me. Like, I can just tell me what to do and I'll do it myself. And so, even as a medical professional, understanding that. And so it's really important that we don't rush things and allow women to kind of ease into the process. It's just very important because I feel like it's so overwhelming. You just had a baby, you may or may not have the information, and then you have someone telling you, well, do this, to do this, and it's just not in that humanistic approach of step back and thinking about how much there is to process right now and easing someone gently into the process and also, encouraging them. And, as soon as they have a hardship, we should be back in the rooms. We shouldn't just say, oh, well, we're ordered formula for you. I happen to be at a breastfeeding friendly hospital, but we also have to make sure that we give them the formula when they want it. Because they'll call me like they won't give me formula. And I'm like, oh, you guys, help the woman process this. Like, just because the baby got formula does not mean that they will not have a successful breastfeeding relationship later on. This one bottle or giving it through a syringe, or, just being creative in helping these mothers. I try to be very creative in assisting mothers, whether it, and I know the IBCLCs they hate the nipple shields. I know y'all hate the nipple shields. Very short-term use. But I'm like, hey, if that keeps you breastfeeding, I'm okay with it, and I tell them that you guys disagree with me. But, creating those SNS devices and other things to really assist mothers and letting them know that they exist, because so many give up because it's not going well. But there's so many things out there to assist mothers. And unfortunately, especially within the African American community, we just a lot of times don't know. And so I definitely applaud organizations, including the chocolate milk cafe. I know they do a lot of work and workshops for women and of color. And I think that it's really important. But a lot of people don't even know about, that organization, which is very specific to women of color. So it's very important that we do our best to check in on women often when we're starting to sense a problem, coming in with compassion and empathy, and just remembering that even the most blunt sounding or rude or whatever, remember somebody just gave birth, and if you've ever heard my birth story, like, I probably was not nice to whoever came in my room afterwards. Like, I probably wasn't. And I don't remember it because I was
pouring clothes on him so that we
I was so anemic that I don't even remember it, unfortunately. But before I got extra stuff, but just remembering that, at each time, everyone is going through something different, and this is a very new experience for many, and so we have to, approach it from a different method, physicians included. We have to do that as well.
To piggyback on what Dr. Jahan said, of course, I relate to the part about her saying about the formula being pushed on the African American community and everything, because my mom, that was a huge thing for her. And I remember, well, let me back up. There's a lot of things at play here that can help change all of this, but it's a combination of things that we need to break down. And I always say, and I'll say it again, education is a big thing. It's huge. It's huge. And I know with my mom, when I was pregnant with my son, because she didn't know, I told her I wanted to breastfeed, and she was huge on, it's probably not going to work. I didn't breastfeed you. Just give that baby some formula. And so, of course, I'm like, no, like, I want to at least try. Let's just see. And, she was just very dismissive because she didn't know. So once, breastfeeding became a way of life for me and my son, and she just learned the different things and how it was just great for him health-wise, she now, hates that she didn't know, the benefits of it back in the day when she was breastfeeding me. She hates that she gave up so quickly. And so I think things like this are so important and imperative to educate everyone, because we need a paradigm shift on just the people who think, it's I'm not going to say it's not okay to not breastfeed, but because some people can't breastfeed and they have to formula feed. But there's a lot of women out there who actually think that they shouldn't breastfeed, or they actually can't breastfeed because they don't think that their breast can produce. And it's just education. So I'm going to stick with that. I'm always going to say that it's a big educational thing. We need a paradigm shift. We need to continue to not be quiet about this. I'll never be quiet about this. I have committed myself to that anytime I can speak about breastfeeding, I will, because it never fails. I'll talk to a mom, especially someone who's pregnant, and I'll always ask. I'm never intrusive, because I know some people are, they're very protective of that, if they're going to breastfeed or not. And I always ask, do you plan on breastfeeding? And they'll probably say yes or no. And if they say yes, I'll tell them the things that I know and just a little bit of information and facts. And they're so mind blown. I'm like, well, I had no idea. I didn't even know. And it's just like, how do you not know that? I'll say that to myself, but it's just like, how do you not know that? It's 2021, but you can't assume everyone knows. And so education is important. And I'm so grateful for panels and discussions like this, because it's going to take this forever for everybody to learn and to know these things. So
I was just going to chime in. We had someone put in the chat about grandmothers who believe the baby needs formula, and everyone has different approaches to it. But for myself, I usually will ask the grandmother why. They often will come in, or sometimes I FaceTime them. Why do you feel the baby needs formula? Well, I just don't think the baby's getting enough. And so for those children, I'll do the weight, pre and post weights and things. Of course, I explain to them not going to see a full 2-ounce jump, but seeing that the baby's growing, explaining to them, that they're making wet diapers and they're, making normal bowel movements, et cetera. These are the things that we monitor. But then a lot of times you'll find that grandmother may have struggled with breastfeeding, or may have, there's a reason why she feels like her grandchild is being deprived. And so that goes along with that same trauma sometimes, is that you have to kind of delve in with grandma to where she feels comfortable as well. And a lot of times you do have to get her on board, because she will be the main person in that mother's ear telling them to stop. Or I'll watch the baby and feed the baby formula all day. But even just inviting grandmothers to the visits and explaining how to store breast milk, how to save it. Because I remember my mother-in-law messed up my breast milk and I almost died. And that was because, and she said to me, well, I never gave my babies bottles because I stayed at home with them. Shots fired. Ooh. That's okay. Well, I'm a working mom, and my baby's getting some bottles. So if you don't mind thawing it out under the sink instead of letting it sit outside all day, I'd appreciate it. So little things like that, just really trying to help educate both generations so that you can get them, on par. And don't be afraid. If the grandmothers are usually there, or they'll FaceTime. They're FaceTiming them anyhow. You don't even know it.
Yeah, coming from a social work aspect, I love that, Dr. Noor. I think it's very important to, I'm really big on building rapport with individuals. I've seen it firsthand. It makes a difference with someone's ability to respond appropriately, to provide empathy, apathetic, to appropriately for me to summarize and to give back appropriate feedback. I encourage to build rapport at the beginning stages, first time meet, second time meet, asking open-ended questions. Because if you do not know or have had those experiences of an individual who may be struggling or may be uneducated in regarding to breastfeeding, you do not know. And that is a great way to build rapport. Sit back, listen, do not interrupt them. Let them speak and feel like they are heard. That matters in the African American community. I hear that constantly from moms. I feel like I am not heard. So I'm encouraging healthcare providers and lactation consultants today. Also, too, in speaking on grandmothers, they are very important in African American community and the success of raising our children. I encourage social support education, inviting individuals in your home, inviting their social support into the home to have educational series and components so that the family understands the importance of breastfeeding and how we want this mother to be successful. Just a couple things bouncing off what we were saying there.
I have a kind of follow-up question, maybe for Jillian, because you really talked, and then Maggie was just talking about the education, but because you said educate if we can, really do that. So, yeah. So, and I know, people can try to have, prenatal classes, so we want you to come to something, or, and maybe they can't. So how do you see, what are maybe some effective ways to further that education and get that educational messaging or what have you to the Black community, to the family, to the mother? What would be some more effective ways to do that?
Well, for sure, I would probably say you need to go where people are. Social media is a huge thing. It's huge. So maybe having, a 30-second clip here and there, drop a knowledge or something on there. And if they want more information, they can inquire and, direct message that organization who released that clip. Or to me, I feel like that's going to be the most convenient way, because we do live in a pandemic right now. Hopefully we're on the tail end of it, but it's not a lot of creative ways we can do that now, but for sure social media is a huge thing. So I think virtually meeting them where they are may be one of the best ways we can do it, like I said. And of course, having somebody that looks like them being the presenter. Don't have a white lady up there trying to educate, some black. I'm just being real. I want to relate to somebody who looks like me. So, make sure it's a woman that looks like her, talking to her about things that she can relate to. So I think maybe just a social media approach. Yeah, I think that'd probably be the best thing that I can think of just right off the bat, just a social media approach.
And I think it's also too, bouncing off what Jillian said, is we need to understand the times. Millennials are the ones that are pregnant at this time. So how do we reach the millennial population? If it's more virtual oriented, social media oriented, that's how you reach the targeted population, the population that is able to be pregnant. Another thing I liked what Jillian identified is meeting individuals where they are. Like I had identified, we need to listen. That is the only way we are going to understand where individuals are. If a mom is pregnant with her third child and she had 2 other children and she struggled with breastfeeding, that's exactly where you need to meet her. You need to meet her and identify her struggles that occurred with her previous children in regarding breastfeeding. You need to listen and understand. Then you can pull out your hat of education and information and things. And so basically assess accordingly. Meet them where they are. And then, okay, I see she had issues in relation to her employment. Then after assessing that, you can move forward and how to best approach with education.
I want to ask them, we just got to question 3. So if you have that handy.
And I'm gonna say, while she's getting question 3, we're kind of getting flood while you're looking at it. But for someone said they're the only consultant and they're Caucasian or they're white, and the hospital. I've actually never seen a Black IBCLC in the hospital. If you are out there, please message me. I've never seen you at any hospital. I've been to quite a few. So you all are in the hospital. And so you are going to be the only ones. And so what we're saying is, everything we're saying is that approach, and realizing, there may be some barriers, and I'm going to make sure that I approach it without any bias that I have as soon as I walk in the room. If I see her and I'm like, oh man, she's not gonna breastfeed because of this. Take that bias, put it out. Just say, this is a mother, she just gave birth, and I want to help her I want to serve her to breastfeed this baby. That's it. Whatever bias you see, just keep pushing it back so that you can best serve that person in front of you. And so the reality is, you all are the ones there at the hospital. So a lot of us might do work beforehand or after, but right then and there, it is you. And you guys are still doing a great job. Don't get me wrong. I see so many mothers who have been helped and assisted, and many people have listened to them, and we've gotten far. They'll come to the office breastfeeding, and I'm like, yay, who did you see? And then some of them I'll send them back to you guys, and they'll follow up with you in the hospital systems and as well. So realize, a lot of things are working. The question is, how can we just make it better?
And it's important to realize too that identifying what Dr. Norris said, yes, I don't see a lot, even other races besides African American, as lactations consultants. But please believe you can be successful no matter what color you are with a mom. That is a humanistic thing in regarding child rearing and childbirth. That's going to continue to occur as generations to come. And with that, to be successful in caring for other races such as you are, you want to self-assess and understand your own views, morals, and values. Please believe that self-assessment is important. Understand things that you value. Understand your why. Your why is to help a mom be successful in breastfeeding. That's what it is. And so if you have other biases and other intentions accordingly, you need to check yourself. please, because it matters. It will matter in doing that for the success of breastfeeding with African American women.
Thank you. That was very well stated and some great advice. I could talk forever about some of the things that you see and helpful things that you don't have to look like us and you can still be successful with reaching us, but you do need to do those self-assessments. I do agree with that. Thank you. One of the things, do you feel that cultural humility type of training, do you feel like that would be beneficial to help address some of the attitudes that are often, present with people of color helping with our moms? Do you feel like that would be beneficial? Jillian?
Yes, ma'am. Thank you. Yes, most definitely. I would be naive to say it wouldn't. I try to say this nicely.
Just do it.
I'm constantly amazed at how many people don't know, like, a lot of the reasons why breastfeeding is kind of taboo or not that special bond in the Black community. They don't really know where we came from when it comes from slavery. A lot of people aren't aware that sometimes as slaves, we were forced to feed the master's baby and not our babies. And sometimes our babies died. And so, that carried on for generations and generations. And I mean, if you think about it, I mean, logistically, that would make sense. If, my great times 10 grandmother, was trying to feed my relative or whatever and couldn't, and that baby died. And, I carried that spirit or that trauma and passed it on to the next child and whoever progressed, of course that would be taboo. And so I think it's important that we all understand why this is even a thing, why Black women are the lowest, when it comes to initiation and duration rates. If we really truly understand why, and not covering it up and not trying to make it pretty. I mean, a lot of the things that I've learned about, our history is devastating. It's devastating. And sometimes we try to make it pretty to present to white people, and you can't do that sometimes. Like, you got to talk about it and get rough and rugged sometimes because it's not beautiful. And so I feel like if we do understand that, maybe there'll be more, I guess the biases will go away. Maybe, I don't know. But I think if we address those issues and talk about the true why and the history of it and the generations of it, I think we could get somewhere. So yes, those trainings would most definitely be helpful, I feel like.
Maggie, do you have any insight on that?
Of course, like Jillian identified, any type of cultural competence, cultural humility training is important. And when I think of that, I think of when I used to work at a hospital and it was the little hour trainings. I would take the little test at the end and it was cultural competence type training. If I can think of that, is usually the amount of what people get training in most healthcare settings. That's not enough. That is just not enough. The cultural humility training or being more culturally competent in an environment, a healthcare setting, has to be implemented in your practices. It has to be implemented in your practices, whether that has to do with getting individuals, helping professionals, encourage, pilot a program that has to do with getting more lactation consultants that are women of color, that are Latino, that are African American. Why don't you do an assessment at the end of seeing African American families in regarding their care on behalf of behavioral adjustment in them being successful in breastfeeding? Those are the type of things, looking at the environment and looking at what's going on and seeing the results and then implementing what you need to do as far as assisting the African American community with that is true cultural competence and working towards being culturally more attentive to the population that you're at. So yeah, it's multiple ways you can have. Encourage more trainings, even whether it's monthly. Encourage trainings of individuals coming in and speaking to the ladder of success you're trying to reach. I think too much is being put at one time and understanding how can we fix this versus starting with A and starting trying to address one thing that needs to be fixed in the African American community with breastfeeding success. Whether we're working on now getting more lactation consultants who are African American. If you focus on that specifically, whether we're looking forward to increasing percentage from 6 to 10% in our numbers with African American women reaching 6 months to a year with breastfeeding. And so it has multiple facets and associated to that.
I definitely agree. Those trainings are great. One of the other things is that, of course, we have to realize that a barrier for many African American women is that the jobs that they have require them to return to work sooner than a lot of their counterparts. And that also in those working spaces, they do not have access to pumping, or, they'll say they do, but they really don't. Mm-hmm. And so, of course, putting those protections and things like that for all women, but definitely looking within spaces for African American women so that they're able to continue. That's why I see a lot of the moms stop. And so I have to be very creative in trying to help them so they continue to breastfeed, because it becomes very, very difficult. I always tell the story. I was actually a resident when I had my twins, and I used to pump initially I used to pump in the bathroom, but then we had a lactation room, but it was on the other side of the hospital, but I only had 15 minutes. So I'd have to hook myself up, eat my lunch in the ER room, close the door, whatever. This is a physician's. If we can't create a space that's easy for you to breastfeed, then imagine what it is for the person working at 7-Eleven. Mm-hmm. So we have to look at a lot of that. But yeah, in terms of trainings are great. And I think that we should have trainings about, implicit bias, and everyone hates that term, but I love it because we all have it. Every single person has it. If you don't have it, then you're not human. So I don't know what you are. So we can't train you. But I think it's important that we do, have these trainings, cultural humility. But one of the best things we can do is just actually be around other people. I know it's times of COVID, so maybe you won't physically be around them. But when was the last time you got into a Zoom meeting or something with someone of a different culture? When was the last time you had a conversation with someone who completely doesn't believe like you believe? And I think that is one of the best ways for us to get rid of our biases, is actually putting ourselves in spaces with people who don't think like us, look like us, believe like us, which actually makes us greater people. And in Oklahoma, it's easy to be in your bubble, very easy to be in your bubble. And it's uncomfortable to get out of that bubble. But if you want to be the best provider, caregiver, counselor, therapist, whatever it is, you have to get out of your bubble, because you can't have that connection with someone if you've never, I'm not saying you cannot ever have it, but you really don't feel it. Mm-hmm. It's like, well, I read in the book that, you're Ghanaian. You guys like jollof rice, right? But have you had jollof rice? Can you relate to my food? And people will tell you all the time, I eat everybody's food. I relate to everybody on food. So it may even be a mother who I'm seeing, and, she's from Thailand. And I'm like, okay, so what the guy, right? Why? Because I've been to Thailand and I love Thai food, and but it's like, wow, you know a little bit about it. And I'm like, so what foods do you like to eat? Let's talk about what you like to eat, because everybody likes food. So even finding other ways to relate to people before we even talk about how you're going to feed your baby. What do you like to eat? And now we're going to talk about how we're going to feed this baby, just on a different cultural road. So even if that is us going to restaurants or ordering food or just learning about different cultures, we would just see our society flourish just tremendously just by getting to know people. I was just blessed to be raised in a very diverse community. So I got exposed to those things very early on through my parents, but my parents travel a lot over the world. My parents actually went to Stanford, so it was a more diverse area, lived in San Francisco. So I've been fortunate to kind of be pushed out of my comfort zones often to where I can relate to people on those things. So I think finding the trainings are great, but I think something that's super easy to do is just learn about people's foods, eat a meal with them, whatever might be the case. It makes it a little bit easier.
Be a human.
Great. One thing I'd like to say, I know we're getting close to wrapping up. But I do want to say for the panelists, I'm often asked by people that don't look like me, hey JP, what are some of the things that I should not say? What are some of the things I should not do? What do Black people like? And, what do you like not to be called? And, if I go into a room with a baby, what should I not say to the Black grandmother? And those are things that, often I'm asked by people all the time because, and I'll be very honest, and Jillian's laughing, but I'm very honest. I often appreciate that they even care to want to know. You know what I mean? I remove myself. Attitude is gone out the window. I have no type of, head snap finger, anything, because the fact that you came to me, you have indicated to me that you care, and that you want to try to do the right thing. And so I'm often led to, from you can only speak from your background and what you're accustomed to, from what I've been brought up and raised and what I've seen, and even as a nurse working in women's health, what patients have said to me when my counterparts leave the room that don't look like them. They say, I really wish she would have da 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 da, or the way you asked me that was so much, that type of thing. So can you all, in closing, can you maybe add a little bit to that?
Wow. I think that's good. I think it's good. It identifies what Dr. Nora talked about, being, getting out your comfort zone and understanding other individuals. I think one of the main things that I start off with when I see individuals and in hopes of betterment, whatever that may be, is I literally say, no matter the race, no matter the situation, it is good that you are here wanting to get it in better situation in regarding whatever it is. It's good that you are here, that you are seeking resources. You want to go in and start just empowering. That's what you want to do. You want to go in and you want to start that way. Like I said, everything is, as far as successes of mother and successes of baby, that is the same across the board. We want our babies to live. Black moms want their babies to live. Black moms want to live. So it's literally the same as far as what we want outcomes to be going through the door. And it's okay too to even throw little icebreakers in there to mix it up a little bit. Hey, what do you like to do? Hey, something in relation. Oh, it's good. I see you have a lot of family here to support you here today. Be a human. I'm going to stop saying that. I really have to stop saying it, because it really is about that as far as being successful. And it's even okay to identify that you may not understand their circumstances and situations. I appreciate that if my doctor says that to me. Maggie, I understand that it's a concern, as far as moving forward. I know sometimes that, struggles with A, B, C, and D, people appreciate that when you identify things as such. And so that's what I'm going to leave with. Definitely go in, being a human. It's okay to ask questions. Please believe me, it's okay to ask questions. It's okay to ask questions to your patients and clients as well. It's okay, because they feel like you care when you ask questions.
Wonderful. Thank you so much. We've come to the conclusion of our panel, but of course, not everybody has to go on break. If you have a few things that you want to stay on here and chat, and of course, my panelists are on a time. So panelists, if you do need to go, feel free.